Hello, it's Lauren Brim, and I am here with Ann Teachworth, and we are going to talk about her upcoming dissection and embodiment lab and why, as body workers, this kind of training is so important. So, thanks for joining me, Ann.
Thanks for having me. So good
Yeah,
to be with you.
I know. Ann and I go way, way, way back to doing musical theater in New York City. So it's super fun to connect. So, Ann, how did you get into dissection and embodiment? And like a real quick, like what's been your journey? For most of the people listening to this are probably PTs and OTs and lactation consultants. And what's been your journey?
Yeah, well, like you said, we go back to our musical theater days 20 plus years ago. So I was a dancer and I got into yoga really young, and I've always been really interested in the body and how it works, but also the mind piece. So I did my undergrad in pre-med and psychology. So I've always been interested in that mind body balance, has led me sort of both directions simultaneously, like real interest in anatomy and physiology and function, but then a real interest in the somatic component and how the mind really is reflected in the body and is the body, and they
Hmm.
reflect each other. And so I have trained in a number of different consciousness-based modalities, and then manual therapy modalities, and then also movement modalities. And one of the big ones is the Franklin method, which is a somatic practice that uses dynamic neurocognitive imagery. So, multimodal imagery and touch and proprioception and kinesthetic self-talk to help people move better and have a better experience in their body. And I have found that to be a really helpful educational tool. Years ago, I also got licensed as a massage therapist, and my husband is a manual therapist as well, with a background in structural integration and functional biomechanics. And so about 10 years ago, he and I started teaching together and putting together these classes. And what I love about the Franklin method is it helps people, especially therapists and practitioners and movement educators, to actually understand in their own body the anatomy that they've been taught. So as I have taken different anatomy as part of my yoga training or my massage therapy training, it is in a textbook. It's 2D. And even when you get something 3D, like a little bit of cadaveric work, it's still a model, and it's treated as a model, and it's not necessarily felt and experienced in the body. And I've taught therapists that have been practitioners for 20 years, and they're like, oh my gosh, I never actually felt how the serratus was connected to my rhomboid and connected to my levator and connected to my oblique and connected to my adductors. Like they hadn't experienced it in their body. And once you get that, then you can assess your clients more clearly, I think, and treat them more clearly. And maybe it's just me, I'm a little slow, like I need that full experience. But people do find it really helpful in education. So my husband and I have these trainings together with our company called Trunamics, we teach advanced continuing education for manual therapists. And then I have a partner in the Franklin method, and she and I started putting together these dissection labs. So, yeah, I went to my first lab 5 years ago with Gil Headley out in Colorado Springs. And it just, because I had all of this embodied anatomical study and background, seeing it on the table, I was able to like integrate it much faster. Gil's like, how do you know these things? Because usually people come to the body and they're like, whoa, it's so different than what I thought it would be.
Mm.
But I had studied in a way that was like really embodied. And so I was like, yeah, wow, this is the thing.
Mm.
Um, and I met a friend in that lab, and he and I put on a lab, and that went really well. And then I partnered with my friend Allie to put on all these subsequent labs. And she and I have been leading a couple labs a year for the last um, 3, 4 years. So this is our sixth or seventh lab now. And we always have a really nice mix of manual therapists and movement educators and, yoga, Pilates, Franklin Method, PTs, OTs, massage therapists, everything. So you get a lot of different perspectives, and yeah, it's very, very fun.
Cool. Well, one of the things that I hear practitioners saying is like we're all like going along and we're doing our work until we bump into one of those clients that we're like frustrated with the results with. Like I didn't like solve the problem there, and that's frustrating. And then it's like, okay, what other tools or like what am I missing? And I think that makes the work really interesting too when we're, always learning and always deepening our understanding, which a lot of students will say like what's next after the bodywork for babies training. And so I think your trainings with your husband are a great, and I'll include a link to that. But I also think it's so interesting just from the energetic side that I also talk about in the course. Like we can't take someone necessarily where we haven't gone. And so, and when we're working with babies and moms, like just today, I left a 5-day-old baby's house, and this baby has terrible reflux for a 5-day old and is spitting up and so uncomfortable. And, I could have kept working on that baby's body, but I turned and spent the last 5 minutes on mom to just hold her body and feel how hiked up her diaphragm was. And if you were to ask her, verbally, like, how are you? Like, she's great. She's home. She's safe. She had a spontaneous home birth. Like, the baby came so fast and like everything looks great. But if you talk to her, like the fear she had about how her partner was going to respond when they realized they didn't have time to go to the hospital, and like, like these stories we carry in our bodies, and the fact that like just some gentle like witnessing and like feeling her body and me feeling what happens in my body, and like we're all kind of shifting together, and then this little baby that's been fussing and spitting up and kicking and arching and in all this discomfort is just like calm sitting there on the couch, like no one touching it, because we've all done the work. And I couldn't take her there unless I'd gone there before. So I feel that as practitioners, we have to do this kind of embodiment work. Like we want to increase our tools and our skill set, but we also want to do the work on ourselves. And I feel like your workshop really embodies both of that. So can you tell me more about, for practitioners, I want to talk about the A and P side and that, but also like what can they expect to go away with as far as like their own personal, I don't know, healing or embodiment.
Yeah. Yeah, that is a huge part of it. What the embodiment practices for me made available is I always say it's like coming home, like actually being able to be home and be safe in my body. And I didn't know that that wasn't how I was. Like I didn't have the
Mm.
label anxiety when I was
Mhm.
little. I thought everyone just experienced existential discomfort in being in their body, and that was just how we all had to be.
Mm.
And so, to go through my own process and then to be fundamentally like safe and at home and comfy and cozy in my experience is so profound. And yeah, like you said, I couldn't do the work that I do with people without that. And that's really my invitation for practitioners is to be on that. And I don't know if that happens in 6 days. Like that was a multiple year process for me. But it is the container that we hold for the dissection experience. And there you I have been in other cadaver labs where they really treat the body like a model and a specimen, and the face is covered, and they're doing regional anatomy. So we're just looking at this section and this section and that thing, and you're taking it apart, and you can just forget that you are dealing with a gift from someone and the echo, like the footprint of their life. And in
Mm.
our lab, we hold it so sacred and with such reverence and care, and recognize that it is an expression of the life that was lived. And it also is a mirror for us. Like it is a chance to really encounter who and what we are. And it's so interesting because we use integral anatomy, like kind of based on Gil Hedley's work, which is instead of regional anatomy, focusing section by section, we go tissue layer by tissue layer. So we spend a day on the skin, a day on the subcutaneous and the adipose, and a day on the deep fascia, and then a day on the muscle, and then a couple of days on viscera, and then joints and nervous system. And you're seeing all of those tissues in everything. Like you can't just separate the layers. But as we're doing that, we're also then doing some movement, some integration practice, just encountering it on our own. So, like, what is the quality, your experience of skin? and your skin. And as therapists, we often press right through it. We forget about it. And same thing with fat and adipose. Like there is so much in the world about fat and adipose and getting rid of it and it's bad and what's wrong with it. But when you look at the body this way, it is everywhere. It is a huge part and it is structural and it is functional. And if we can take some of that story away and really encounter it for what it is, and then take that as a mirror to be like, oh, what's my fat? What's my story with my adipose? And same with the viscera, same with the fascia. And so what I find is that, each of those tissues have a different tone, a different quality. One of our kind of catchphrase or motto is to find out what you're made of. And so it really is this chance to connect with the different qualities that are what you're made of, not your identity qualities, but like literally kind of the vibration and the manifestation in physical form. And then throughout the week, people have different experiences based on different layers. Like some parts are like, ah, it's not a big deal for me. And for other people, like seeing those lungs, that is the thing. Or seeing the fat is huge for some people, or even just reconciling skin. We have so much about what skin is and protection and separation and all of this. So I
Mm,
think it because of the way we invite the embodiment practice, that it's not just thought about it, it's really experience of yours,
hmm
and an encounter with yourself in a space that is safe and wherever you are is perfect and great.
hmm
Um, and
And is that
we
held
don't do
outside the lab? Like this is a facilitated kind of like, okay, we saw that in the lab. Now let me feel it in my own body.
Yeah, and we usually do both where we'll like start with a session that's like let's get connected with this in our body. Then we'll go into the lab and we'll work with it in our hands and then we'll go do another integration process. So you have and we weave in the anatomical education so people have different levels of knowledge about different areas, like if it's not your
That's my
area of
question too.
specialty. So
Hmm
we want you to know what you're looking at and what you're looking for, but we also want that integrated into your own experience. And some labs do a little bit more verbal processing, and that is great. But we don't do a ton of like, let's talk about our feelings. That it happens, they can go to lunch together, they do dinner, like people get to do that. Ours is really more the somatic processing, which is nonverbal. So people, you are sharing, but you're getting to have a body experience of it that I think is so profound. Um, and very different from, how most labs are run.
Yeah, cool. So someone who has had lots of anatomy, physiology background and someone who's had very little, like everyone's welcome and would feel comfortable with the dissection.
Yeah, we have people fill out of like a registration form, and you have to have some reason to be there. So everyone is some sort of practicing manual therapist, massage therapist. Though my mom, who is a retired physician, she did come to one and had a great time. So it was a very interesting mother-daughter retreat.
What was her takeaway from it? Does she have a
Oh, she had an amazing time. Yeah, it was totally different than how she had ever done dissection, or talked about anatomy or thought about anatomy in her medical school training. So it was very fun.
cool?
Um, so some experience, but people will have very different levels. And we actually have a lot of people who come back. So in our October lab, about half of them are that have registered so far are repeats, and then they'll be new. So that's nice too, because you have people who are like kind of taking it to a deeper layer. And every time I keep leading them because I want to keep doing them, because every time I do them, there's kind of more that that you discover.
That's so cool. I love that. Like the body's a treasure chest. It's like forever teaching us and bodies look so different when you open them up. I know I've learned that long ago. Like the body does not look like the anatomy. The spleen is in a different area and different people. And I always share that with moms about their babies because as we're working on them, they'll go into their in utero positions. It's like the babies don't look like they do in the anatomy books, like in this perfect little symmetrical fetal position. They get into really funky positions that we have to help unwind them from. So Speaking of unwinding, and this is my last big question for you, but what can practitioners expect to learn about fascia? Because when I'm teaching it online, we're watching videos and, but what's it like what do you notice in dissections about fascia? Like what's really stood out to you that you wouldn't have known from the textbook, when you do dissection?
Well, yeah, I will say I think this is a big differentiator from other cadaver studies, especially if you're looking at like a PT or kind of medical school setting. Because I've done those. I've done like a PT AMP course. And on day one, they took everything away in the area we were studying down to the muscle, and the instruction was to make it look like the model. Take
Mm,
every, and I was like, what about all of the fat and the superficial fascia and the deep fascia and all of these things? They're like, yeah, just make it look like the
not
model
important.
to the
Yeah.
muscle fiber. I was like, but the muscle is nothing
Yeah.
without these things.
They care
The
so much
muscle
about the
can't do
muscle.
anything.
Yeah.
Yeah. And when I teach fascia, I show Rubens' vase, the candlesticks and the negative space demonstration of like, do you see the vase? Do you see the candlesticks and or the faces and the vase, whatever it is?
Mhm.
Because in anatomy, we're always just looking at the muscles and we're like not seeing the container. And so the way we do the lab is like, you don't, and I even try to tell people like, don't look through the curtain, look at the curtain. Like, don't just peel away the things, look at the thing that you're peeling away to get to know. So, one thing that is very surprising to people is the superficial fascia and the superficial adipose and the deep adipose. So, we go through the anatomy of that, how it relates to the layer above and the layer below. But it's such a significant full body fleece that has a 3D scaffold
Mhm.
and has capacity for cushion and slide and separation and shear and distributing forces. And it's sensory and it's immune and it's endocrine, like this very significant structure, structurally and functionally, that is just literally treated as garbage. So we take time to consider that. And really, when you're doing manual work, like below the skin, that's what you're interacting with before you ever get to anything. So that is a big part of the fascial body. And then we take all of that away and we look at the deep fascia with everything, all of the fat taken off. So it's not regional. We're looking at the whole system. And so then we can really look and see, and we encourage people to name things. So, like something that I've named is the IM band instead of the IT band. Because if you really look at the fibers from the IT band, like they don't stop at Gertie's tubercle below the knee. The IT band doesn't, that's fantasy that the IT band is this like the
Mm,
thing you see in the book made up that with a scalpel, someone cut that and made it look that way. It's not at all what it looks like. It's
mm,
embedded in the crural or in the fascia lata, and
mhm,
then it continues into the crural fascia. Like the fibers continue right down into the lower leg, into the
mm,
tibialis anterior, and then right onto the medial foot. And when you really tune into that line in your own body from the medial foot out to the lateral leg, up to the hip, and even into the glute max, like that is a really interesting functional line where force, of course, has to be distributed along that line. And of course, if something is happening with someone's IT band, it's happening with their tibialis anterior and their ankle and their hip and their glute max and their tensor fascia lata. So if
mhm,
you just look at like the thing in the book, you don't see any of this.
mm,
The other thing is it has a huge connection to the femur. It's
mm,
not a like floppy loose band. It has this dense connection.
mm,
So things like that, where we get to see what is the full continuity, or the adductors into the contralateral obliques, like getting to consider what is this line of force. And the deep fascia really does tell you about force in the body.
mm,
Even recently, I was in the lab with a chiropractor and we were dissecting the lateral arm, and there in the antebrachial fascia, there are these like really dense fibers in a different direction. And whenever you see organized, dense fibers in deep fascia, that tells you that it's managing some type of force along that line. And he just doesn't really think force necessarily. But I was like, well, it's representing the line of force. And he was like, the line of force. The line, like it was this big moment of like, yes, of course, it's managing force. And
mm,
when we take that out and we just think force is muscles, where there's no way our body could do what it does if it was the muscles.
Mm-hmm.
So yeah, looking at it that way, we get to appreciate the patterns of force maintenance, whether it's force generation or force distribution or force absorption, and start to play with that in our own experience.
Yeah.
And then you see anywhere where there are restrictions, that's going to be a part of their movement expression also.
Yeah. So you can see the fascia restrictions when you're dissecting and understand that a little more. And do you also look at floor of the mouth or pelvic floor or the dura mater? Are we looking at
Do
all of
it
it?
all. Yes, we do
Yeah.
it all. And the
Okay.
beauty is we have 5 or 6 people per table, and we have 2 or 3 tables. So right now for the fall, we have enough people for 2 tables. We have a few more spots that would add another table, meaning another cadaver.
Okay.
And so that means you have a bunch of different forms, like you work on the same one for the 6 days, but then you can go around and see what different models are showing and, male, female.
Different bodies. Yeah.
And when you have 5 or 6 people at a table that have different experience and different interests, you can kind of focus on your project, your area of interest. So we teach the dissection skills, we have dissection guides, we have suggestions for how to explore different areas, and we'll teach you. But then also, you doing it is the learning. So people will come in, we've had vocal coaches that interested in the cores and that design. We've had pelvic floor specialists that are really interested in the pelvic floor. So then everyone gets to benefit from that
Well,
exploration.
cool, cool, cool. Well, it sounds so fun, and I'm personally planning on being there. And I know it's also kind of like a retreat for people to get away. It's in beautiful Colorado Springs, and there's hiking and fun
Yeah.
things to do while we're there as well. So, and I understand you have a coupon or something you're going to share with me to share with the group.
Yes, I will do that so they can get $100 off their registration. And yeah,
Okay, cool. And I'll include your contact info in case people have questions. But yeah, it's exciting. The last time I was dissecting was almost 20 years ago. So yeah, it'll be fun
yeah.
to and to learn from you and all your knowledge. Tell me.
One more thing that's different. We use unfixed cadavers. So no formaldehyde, and the tissue is fresh tissue. So they've only been frozen, and then we thaw in time for the class. And so it's much more pliable and movable, and all the joints move, which is not available in a fixed formaldehyde cadaver. So you
Wow.
can really get to explore joint mobility and really appreciate like how floppy muscles really are and how the tissues might be.
You have a lot of feelings about muscles, Anne.
I love muscles. I just there are so many other things.
Yeah.
The body is an ensemble, It's
Yes.
not
Yes.
muscles are
Muscle is not
treated
the
like,
star. She is not the star.
yeah, right.
Yeah.
Yeah.
So funny. Okay, awesome. Well, thanks for your time, Anne, and I look forward to studying with you in October. And thanks everyone for joining us. I hope you got some ideas and let us know if you have any questions. Okay,
Thanks.
bye-bye.